guys, so we're here, we're microneedling the skin today. And for those out there that don't know what microneedling is, it is a collagen induction therapy where we're able to utilize little baby needles by passing over the skin at a controlled depth to stimulate wound therapy. And this basically is going to now stimulate the skin, produce more growth factors, which then will also help with producing more collagen. We can utilize this for fine lines, wrinkles, scars. It's a textural thing. Even if you don't have any of those issues now, what you could do is do a treatment like this, and it will actually help to prevent your aging process because you are stimulating the collagen. It's going to feel nice and tight afterwards. It's a little sunburn feeling that dissipates about 24 or 48 hour downtime. And we do numb the skin before we treat, so it's fairly comfortable. How comfortable would you say you are?
Totally fine. Doesn't bother me at all.
So we always like to make sure we're doing at least 3 passes through the face to make sure each area has been hit, kind of like when you're aerating a lawn. The goal is to have the healthy tissue kind of come in between where we've created those little wounds to stimulate everything. And today we're just using a little hyaluronic acid to microneedle into the skin. You can also do PRP, which is platelet-rich plasma. We would take the blood, we would spin it down, and we call it our liquid gold. It has all your platelets, and that just helps to further stimulate collagen as well.
Now, can everyone be a candidate for this, or like, are there some?
This is a great treatment for all Fitzpatrick scales. So from Fitzpatrick 1 to Fitzpatrick 6, everybody can be a candidate. We always recommend you coming in for a consultation to make sure that it is the right treatment for you. But pretty much everybody can do this treatment. You may have different reasons as to why you're doing it, but yes, everybody is a good candidate. The treatment itself is not that long. We would typically book you out for an hour. And between cleansing the skin, prepping the skin, and numbing the skin to treatment time, you know, the treatment itself on the face with the microneedling pen is about not even 10 minutes. Today we're going to stage it a little bit since, you know, we're demoing for a little while.
And how many treatments would you recommend?
Depending on what the person is looking to do. I mean, we sell them as individual treatments. They're always a good treatment to do for maintenance of collagen stimulation. But if, you know, depending on what they're looking to do, we also have them in series. Scarring, fine lines, wrinkles, more versus less. But again, that's one of the things we would say, come and do a consultation for, so we can really kind of give you the best assessment as to what's going on with your skin. Doing okay? Does it feel tight yet?
A little tightening, but nothing hurts at all.
No, nothing should yet. So we use the Eclipse pen here at the Breslow Center. It's one of the best pens actually to use. It's got a lot of safety features for not only the technician but especially the patient, especially because we're dealing with bodily fluids. It's 12 little baby needles that is on this head, and this is a disposable needle. And we are not injecting anything, we are not pulling anything out of the skin, we are just passing over the skin to lightly introduce little wound therapy. There's a protective shield that we would put over the device to also help make sure that there's no bodily fluids going where it shouldn't. I'm just going to pull this needle out so I can show you. This particular device has a protective shield over the shaft, so to make sure there's no backsplash going into the device for the protection of our clients. Not all devices do this. So it's really important when you're looking to do these types of treatments, you are making sure that the actual treatment pieces that they're using are adequate for the safety of your clients and also treatment.
Now, if that wasn't on there, like moisture, what's going in there?
This is just the hyaluronic acid.
Okay.
So it's the medical version is sodium hyaluronate. So it's just a super hydrating serum. It's not going to interfere with anything. It's just giving us a nice slip to go over the skin. The skin's going to absorb it very quickly. I'm just going to give myself a little bit more here. And if there are any questions out there, please feel free to chime in and ask away. This is just one of the many treatments that we do. the nice thing about this treatment also is that if you're already working on the skin with lasers, or you're planning to work on the skin with lasers, this is a great treatment to select to do prior to the laser, to prep it, or afterwards to make sure you're getting treatment in between lasers, because depending on the depth that you're doing with the laser, your downtime can be 2 months to even longer. So in between, you can continue to turn the skin over with a treatment like this as well. And again, we would make that part of your treatment plan when you come in to do a consultation.
After the treatment, would she like need to avoid being out in the sun or putting anything on her face?
Yes. So what she's going to do after the treatment, post-treatment procedure, would be to keep reapplying the hyaluronic acid, or sodium hyaluronate in our case, because it is the medical version. You will avoid the sun, any waxing, tanning, whether it's tanning bed or sun, and that's just because the skin is sensitive, and we know that those are free radical damages. The skin's going to be a little bit more sensitive. Within the 24 hours, she can reapply her makeup and go on, and she might even be, depending on how her skin responds tonight, able to reapply makeup. I would always say to my clients, wait 24 hours, and then by tomorrow she should be fine. A little swelling is natural or normal. It can be expected, usually not, but we have seen that in some cases of people whose skin is very sensitive. It's not a deterrent to doing the treatment, it's just something that we would look for when we're planning out the treatment for their schedule. And again, I have control over how deep I'm going over the skin. I know on YouTube you can see that there are doctors on there maybe going a little bit more deep or aggressive. People are bleeding all over the place. There's some crazy things happening. It's not necessary in order to receive treatment, as long as you know, are keeping control of your depth and what you're trying to target.
Is there any prepping that needs to be done beforehand, before the treatment starts?
Well, we always recommend that our clients do take care of their skin prior to any treatment, just like going to the gym. You want to make sure you're running on the treadmill before you go to boot camp so you can get the most out of it. However, it's not necessary. Sometimes we start treatment, we start the skincare process with a deeper treatment such as this to kind of get everything going. You know, it's again going to depend on what goal you're looking for, who's treating you. We do typically like some type of skincare, healthy skincare routine in the system before we begin. Healthy skin always heals more quickly, but it's not a make or break deal. Okay. So now what I'm going to do is I'm going to let her skin rest on this side. We've actually treated this area, and like I was saying, since we're doing this as a demo, we were doing different quarters of the face at different times. What would you say that you're feeling on this side of the face?
A little tightness.
A little tightness,
yeah.
Maybe any little sunburny feeling yet?
Yeah.
A little sunburny.
Like the beginnings of a sunburn.
Correct. Like if you just kind of notice that, hey, maybe I was out in the sun a little too long, I'm going to go back inside and reapply my sunscreen. So on this side, what I'm doing is I'm actually going to apply the numbing cream so that we will start working on this side as well. And today I'm omitting her forehead. We're going to actually probably work on the neck. So I'm just applying this little numbing cream. The numbing cream helps allow for it to be a little bit more tolerable. I can speak that, you know, myself, I don't necessarily put numbing cream on to do this procedure. It works either way. This just kind of helps buffer any discomfort that you might feel.
How long does the numbing cream take to be in effect?
I typically, this particular numbing cream, this is actually given, or this actually comes from the company, and I probably would say to about 10 to 15 minutes. It's very active, so it doesn't eat up a lot of the treatment time itself, which is why we can get you in and out within that hour's time frame. I'm actually going to go ahead and bring it down through the neck right here as well.
And do you have to worry about skin sensitivity at all during the treatment?
I'm sorry, skin sensitivity?
Yes.
Well, I mean, we're looking to see, everyone obviously does respond differently, so as a technician we are trained to modify anything if we feel that somebody is too sensitive or if somebody is uncomfortable. We will always adjust and modify to the client's needs, but because it is a medical treatment, we know that we're looking for a reaction within the skin, so we know the skin is going to respond and it's going to turn red just as we want. So if you look at the side of her face now, you can see just that nice pink, that nice healthy glow. And you can tell she's had a medical treatment exactly like we want. And this is what we're looking to achieve. I'm actually going to do this side too, because by the time we start working through. Yep, so it's very, I don't want to say an easy procedure, but it's very straightforward. It is exactly how it's described. And the needles, again, they are safe, they're disposable, everything is protected, and it is appropriately cleaned and taken care of in between clients. Clients will go home with a little kit that has the hydrating serum in it for them to use at home to continue to apply, and that's all they're going to really do once they get home. It's in a nice little tube like this. This is a hyaluronic acid, sodium hyaluronate if it's a medical grade, and just put it in a nice little box. We'll give her little instructions to take care of maintenance, and of course we're always available 24/7 through phone or in email if anybody has any questions. This is what is applied. This is what comes with our little kits to their skin, and of course it's separated, so if anybody has any allergies or anything to worry about, we can modify it for them. And this is her little treatment set. So this again is all. And this is what we're using on her skin today. I'm just going to grab another pair of gloves. And so now we're just a little numbing process. If there's any questions, anybody can chime in, they can ask away. We're just showcasing the microneedling today. Now this is a medical treatment. We do like to do it in a spa setting, that way you're nice and relaxed. Anxiety can always stimulate more sensitivity, so we do like to do anything we can to make a client feel relaxed. Nice music, spa setting.
Now, what is the main question or concern that you usually receive when people are questioning about this product or this treatment?
Texture and rejuvenation. So that's probably the first and foremost. People will come in is because of the texture of their skin, whether it's fine lines, wrinkles, the aging process itself. Could be acneic scarring, it could be trauma scars. I have done this before I have actually a scar on my face from a dog bite. So you can do this, and you can do it as often as every 4 weeks to help with scars, fine lines, wrinkles, the whole cellular rejuvenation. That's what we're doing here. It's collagen stimulation, collagen induction therapy is how they call it. So stimulating growth factors, and the growth factors stimulate your collagen.
Now,
if
you had any Botox or surgery done, would you not recommend it, or would?
So I mean, it's not. You can absolutely recommend it. They work together. They're synergistic. As far as how you're going to space them, it's going to depend on what you're used to in the past. When it's a new procedure to a client, we always try to give a little bit more downtime so that you can see how your skin is going to respond to this particular treatment. If you're going to get fillers or Botox, you can actually do this treatment right prior to actually doing another service, if you've already been doing that in the past. I mean, it is recommended, to give yourself a little bit of a week, maybe to eliminate any sensitivity, but, there are different things that we can do to comply with the client's schedule as well.
Okay, cool.
So this is just going to set on her face about 10 minutes just so that she can numb and feel a little bit more at ease with the treatment itself. Numbing is not necessary, so if you're afraid of numbing, we don't have to numb. It is still tolerable. You might be a little bit more sensitive than if you had the numbing cream, but it is still a tolerable treatment, and we can modify it to where we're doing more passes with a lower setting if we need to. Are there any questions out there for anybody?
Not yet. This is the most liked live video so far, though. Everyone's liking it.
Love it. We love this treatment. It's a phenomenal treatment. I actually love to do this treatment in conjunction with photofacials as well, because the Cyton machine that we use here also stimulates collagen. It helps to brightening the skin, any rosacea, anything that's bothering the skin. You don't have to do it on the same day, but it is a lovely treatment. It's a little bit more aggressive, but it's great to get 2 birds killed with 1 stone on your appointment for the day. So I'm just going to let this set on the skin a little bit more. I'm going to change my gloves out again since I was just massaging it in further. And I'm just going to grab a little bit more hyaluronic acid because my bottle's a little low. I'm going to grab a little bit more of this. I'm just going to give it a second.
So how's your skin feeling? Do you feel the numbing at all?
Yeah, tightening.
Okay.
Yeah. Oh, this feels great over here, but over here it just feels tight. But we all like a little tightening, right?
Is this your first treatment?
Yes.
What made you want to get this done?
I do the photofacial and I love it. It's one of my favorite things. I just did my lower arms the other day, and it's just, I've had friends that do it, have done it, and love the outcome. So just fine lines and wrinkles and.
So
the treatment's the same on both sides. It won't matter. It's like, say, one cheekbone's higher than the other.
No, nothing's gonna make a difference. I mean, now I will say that you can see even when you're looking at her skin, not everything is responding the same because nothing is symmetric. Even Dr. Farkas, Dr. Breslow, they'll tell you you're gonna have some blotchiness. Everything responds differently, but it's still her skin. So it's nothing to be alarmed of. We know we passed this area, and that's one of the reasons I do 3 passes to make sure everything's been targeted. But everything responds differently. Everything will feel tight. I'm actually going to put a little hydration back into her skin now.
Do you flake off at all with this?
So what's going to happen in the next couple days is you may have some dryness, some flakiness to the skin because you are exfoliating and stimulating that exfoliation process. You just go on like you would normally do and continue to hydrate your skin.
Okay.
And that tightening, that feeling that you're feeling, that tightness will last today, tomorrow, and it'll start slowly subside. Not because the treatment is done, but because your skin is now turning over and you're going to get the other effects. And the more you do, the more you see. So you're going to be piggybacking on each treatment. So the first time you might be more sensitive. The second time you're going to be less sensitive, and you might feel even more tight the second time because now we have healthier cells that we've stimulated, and now we're turning over those healthy cells. Now we're going to stimulate more healthy cells. So it's a piggyback process with most of these treatments. And the more you maintain your skin, just like your body with working out and your muscles and things like that, the more you're going to get from each treatment that you do, and the more you're going to see.
Okay.
You feel pretty numb on this side right here?
Yep.
Okay. So I'm going to actually just start taking off the numbing cream from here, and we'll work on this area. So that everybody can see how this, again, this process is. This numbing cream is pretty fast acting. It's actually formulated, like I said, from the company themselves. And anybody who has any questions, like I said, you know, we schedule free consultations to come in. You're not obligated to do anything or purchase anything. It's really just a nice educational consultation for any of the concerns that you may have for your own skin and what type of treatments you can do to target, whether it is or is not microneedling. We have plenty of things to select from. So I'm just looking at my pen again and making sure I'm at the right settings that I want for her cheek. And I'm adjusting accordingly.
So as you do additional treatments, do you sometimes go deeper?
Yes, depending on what the person's skin is like. Like I know your skin and I know how your skin's going to respond, so I can actually start at a deeper point. Somebody who, like I said, is their first time, we may alter it a little bit just for their first treatment in. I do know how her skin's going to respond, so I can go a little bit more aggressive without having to fear that she's going to have some type of bad response. And when I say bad response, where she may be more sensitive and be fearful of that throughout the weekend. So we've kind of prepped the skin. We know what we're looking for and what's going to happen. So I can go a little bit more aggressive. So I'm just going to start here at the base of her cheek. Does that feel okay?
Yeah, fine.
And of course, we're always using gloves, keeping our universal safety standards up to par. Not just for our clients, for ourselves as well. And that's very, very, very important when you're looking at a facility to do these types of treatments.
Yeah.
You really want to make sure health codes and standards are being considered. So you can see with one pass, we have some faint pinkness, some slight pinpoint bleeding. Those are not our objectives, but our goals rather.
It can happen though.
It can happen. It's nothing to fear. You may see on YouTube people are bleeding all over the place like crazy, or calling it the vampire facial as a patented name, but that would be with the PRP rather than hyaluronic acid being worked in. This is one of my favorite treatments here.
Have you done this on yourself?
I do this on myself? Yes, absolutely. It's an amazing treatment for stimulating collagen, keeping that youthful glow. Also, again, because I have scars on my face, it's a great treatment to really try to help break down those scars before I go and do something like a laser, which I would still do. It's just helping to soften it so that when I go to Dr. Farkas, who's going to perform the laser resurfacing, he's got a better palette to work with as well.
For someone with acne, that would the scars of acne,
Yes.
that would really help, right?
Absolutely. This really helps to soften stretch marks. We work, and this is not only geared toward the face. As you'll see, I am numbing her neck. We are going to work on the neck. You modify it accordingly to what body piece you are working on and to what it is you're trying to target within that area. Now, I'm not limited to only doing 3 passes. If I see that there's an area with extra fine lines or wrinkles or extra scar, I can work on that area to my liking to give it, more aggressive of a treatment. And some may say, well, what if I'm too nervous to do an aggressive treatment? Can you go light and will I still get benefits from it? Absolutely. We always can work within a client's comfort levels as well. We don't want anybody to be fearful of a treatment. We want them to enjoy and really look forward to the results we're going to receive from what they've selected. Now I'm just going to come right underneath her eye, but I am going to adjust my settings for that area because we do know that that tissue itself is more sensitive. So even though I am going and able to treat her skin more aggressively, there are still certain parameters you're going to work within depending upon what area that you're treating.
About researching this, like if you're a first person trying to find what company is the best, who uses the best tools, how would you go about like looking this all up?
You just have to type in microneedling, and you'll see that there are different devices out there to use, and you are your best advocate. So things are going to cost different, look different. The best thing I could say, the first and foremost, because we're working with bodily fluids, you always want to make sure safety precautions are, to me, the biggest, and obviously then the efficacy of the actual treatment. But because certain devices take more precautions for the safety of passing around bodily fluids, to me that would be kind of like the highlight. You don't have to type that in. You could if you would like, but I would just type in microneedling. This is the best device though, and at working with it for the last couple of years, it's been phenomenal. I have, so many wonderful results, and you can really change the skin with this treatment in itself. I mean, there's definitely other things that we would do with it, but this treatment alone is phenomenal. So I'm using my judgment based on how she's responding. I know that I can go back in underneath her eye a little bit more.
Does the one side require like more work than the other?
It may. There is, basis, nothing is symmetric, 100% symmetric. Asymmetry is there. Part of finding the beauty and making somebody more beautiful is trying to get it more symmetric. So if one side, especially our left side per se, because of the way we drive in America, is more exposed to sun damage, you may have more damage on that side, or you may be more prone to wrinkles on that side.
Yeah.
She actually doesn't have very many wrinkles or anything like that. So, I mean, in this scenario, I mean, I'm going to treat, like if she had more wrinkles over here, then I would go more aggressive on it. But in this case, she really doesn't have that. But if there was, we would always treat appropriate to whatever area we are on. Okay?
Because I visit the Breslow Center.
So now you can see from one side to the next, one's a little bit more pink, that's about, I want to say late bloomer. Sometimes people won't get super, super pink, but we call that late blooming, where you're fine and then it turns more. There's nothing to worry about that. This is an absolutely beautiful response on this side. And again, this is directly after, and that's also a very beautiful response over here. I am going to wipe the numbing off her neck, and I am going to come down through her neck and treat. We don't treat, when you're doing a microneedling treatment, it is just the face unless we specify that we want to do additional areas, which we are able to do. Like I said, you can do stretch marks, so I have done plenty of bellies for us lovely mommies who may be experiencing something like that, and we're not quite ready for surgical procedures to remove that, but we also do that as well. Sometimes it's just a matter of changing that texture of the skin just by a little bit to feeling that much better about ourselves.
Take that off?
You don't have to. I mean, you can if you feel uncomfortable.
I'll just take it off real quick. So.
Okay. There's a slight burning to the skin, I would say, from my own personal experience. How would you feel like the skin feels right now?
Well, this burning went away. It's just
it doesn't last
feeling.
long.
No.
It does.
So
it's
now
there and then it subsides out.
Yeah, it does. Yeah, that's already gone, and this side's a little. It's a little nothing.
Would you like to say anything to the viewers before we go, or anything else to add?
Well, our phone number is 201-444-9522 should you have any questions. It is the weekend right now. We are live. We are doing a nice little event that we like to do every so often for our clients. If you have any questions, please do not hesitate to reach out to us. You can email us. My email is mdivincent@breslowmd.com. It is attached to my phone, so I will respond to you as soon as I get it and as soon as I am available. Otherwise, give us a call. You can set up a skin consultation to come in, even if you're already using products or any questions that have already been answered, but you're just not 100% on the information you've already received, or if you're thinking about doing something but you just want to really kind of make sure that that's exactly what you should be doing. We look forward to having you come in, and any other questions, just feel free to contact us, okay? All right. Have a wonderful weekend.